Hope everyone watching this video are safe and healthy. COVID-19 pandemic has been going on for months. We would like to take this opportunity to share some medical and rehab experience regarding treating COVID-19 to your team. Before we go into any update clinical practice around the world, we would like to build a foundation regarding what exactly happening during the pandemic using a graphic illustration. X-axis is the number of population, Y-axis is time. Most of the countries are now in lockdown and imposing social distancing policy to flatten the curve. Day 0 means confirmed infection. Patient will be isolated, either at home or isolated ward, depending on country. The green line from day 5 to day 12, 80% of patients recovered and 20% may need intensive care. The goal is to reduce the 20% to ease the burden of medical care system. Then the question is how to lower the needs for intensive care. WHO encourage exercise to boost up immunity and reduce the needs for intensive care. News reported COVID-19 patients in China were doing active exercise during the stay in interim hospital. They did it not only to create a positive atmosphere, but more importantly, it's to strengthen the immune defense. Exercise stimulates immune system and strengthen infection defense. Raise in body temperature occurs following an exercise session can mimic the environment of fever created when the body is fighting infections. Coupled with the increased flow of white blood cells, recovered is typically hastened. It is also essential to do active exercise at home during lockdown. PT management of acute COVID-19 recommendation is published in March 2020. It recommends early mobility, exercise, early functional recovery for ICU acquired weaknesses. Now, we move on to share some latest clinical recommendation. After the first confirmed case in China last year December, China had already summarized their clinical experience and published a handbook of COVID-19 prevention and treatment. The handbook highlights position management using gravity to assist excretion drainage. A Singapore hospital also addressed prone position improve breathing function and oxygen level. This could maximize patient chance of recovery. This hospital uploaded an educational video on YouTube, and the link is shown on the screen for your reference if you are interested. Going back to the China handbook, it also addressed using electrical muscle stimulation is an important part for COVID-19 patient rehab. Hospitals in Italy are using our STEAM device during this pandemic. We are proud to support the heroes. A Hong Kong physiotherapist pointed out in 2010 the importance of early rehab in ICU. Otherwise, complications can delay the weaning due to the respiratory muscle weakness. A research in 2017 demonstrated NMES for critically ill patients. The NMES group showed less difference in terms of abdominal and chest wall thickness after the stay in ICU compared to non-NMES group. NMES group also found to have significant shorter length of stay than non-NMES group. This helps to reduce the burden of ICU as we discussed it at the beginning. We hope you find this information useful and may want to share some insight to your customers. Hope that this could be a support to them. In the meantime, stay safe and stay strong.